All right, good afternoon, everyone. So thank you all for joining us today for the South Texas Regional Family Medicine Grand Rounds. Next slide, please.
Dr. Vargas, can you advance the slide? Thank you.
So thank you in advance for being attentive to the presenters and engaged in the session, registering for CME credit for each session, completing and submitting a session eval form. Next slide, please. So here's the code for today to get your CME credit via text. I'll leave this up here for a little bit so you can all claim your credit. This might actually be the wrong code. Let me double check. I'll add the new code in the chat. Let me make sure. Hold on 1 second. Yeah, I will add the right code in the chat. We'll go to the next slide, please. This is just information regarding the AFFP credit system. Next slide, please. And these are the core competencies that the Grand Rounds will address. Next slide, please. And here's Dr. Shi to do a brief intro for us.
All right. Thank you, everyone, for attending the first Grand Rounds of the academic year. So we have Dr. Vargas, who comes to us, actually not that far away. So she's a graduate from UTESCA, had received her doctor of medicine degree in the year 2000. She subsequently received a master's in business administration from Texas Tech University. So she has previously been had a joint appointment with the Family of Medicine department as well as the Department of OBGYN at UT. So a lot of our colleagues has worked closely with her in the past. She is a National Health Service scholar and served both in the San Antonio area as well as in the border town of Laredo. She works as the OB hospitalist for the past 7 years, recently transferred to Community Care Healthcare Center where she works part-time. Apologize. Dr. Vargas currently has an academic position with the UIW osteopathic medicine. She is currently at the rank of associate professor. She's has teaching responsibilities, working as a course site director, recruiting physician preceptors to assist with student rotations. So outside of academic medicine, she likes to travel. She is a connector, and she's excited about this opportunity to go to Paris to watch the Olympics this summer. And her academic interests are in lifestyle medicine, women's health, and educational facilitation. So without further ado, take away Dr. Vargas. Thank you again.
Thank you, Dr. Shi, for the presentation. Are you able to hear me? Yes? Okay. Yes, okay, awesome. Hi, Dr. Nato, good to see you. So it's a welcome home, I guess, of sorts, because I would say that my medical career started with the Department of Family and Community Medicine 20 years ago. And Dr. Hayen, very appreciative and grateful that he gave me the opportunity to come in and teach as the family medicine program, women's health. And so the one thing that stayed true, even though I've been in and out of different locations and so forth, is the commitment for education of future residents and medical students and other nurse practitioners and PAs and so forth. And so that definitely has been the thread through my whole career. And so I wanted to bring that to you today in this invitation. Thank you, Dr. Hayen, for having me here, Dr. Bazaldua for making the offer of me presenting today. I will say that, I've always been a little bit of a complicated person, and so I don't do just things at the one level. It has to go like the over the level. So it's like, okay, the birthday theme will be like dance, disco dance. However, it's like dress up as your favorite hero for the dancing and disco dance theme. So with that is how I decided to talk about hidden rules of class with professionalism. And so as faculty of UT Health back in the day, we did have a lot of international medical graduates, and I can see that you continue to have this and so forth. And so they were some of the most incredibly intelligent, well-rounded, well-versed, resilient residents that I could have and that I've ever worked with. But the truth of the matter that when it came to the connection with being able to practice medicine and trying to fit in and trying to know the system, there was always some hiccups. And so over my career, I've been able to identify, well, maybe there's some special tactics or some special rules that maybe we could learn about and how we can improve this so that our residents continue to be more successful. And so this is the nature of my topic. So when I'm talking about hidden rules of class, I'm actually using it through a lens. Through life, we look at things and we see things through different perceptions. The perception that I'm going to use it through is through the economic lens. And so these are definitely generalizations, and there are definitely exceptions that do exist in this. But overall, this is a way to look at things on how to better make us better people and understand this. So what are hidden rules? Well, hidden rules are unspoken cueing system that individuals use to indicate whether you're a member of a group or not. So they're hidden because no one really tells you that you broke the rules, but other people will know you broke the rules and they'll look at each other like, oh, they don't belong because they just broke a rule. So how could one of those be an example of that? Speaking loudly, right? So you come in and you're talking amongst colleagues, and this happens a lot with the Latino families or the Latino residents, that we speak a little bit louder. People think that we're mad or that we're angry or that we're passionate, and it's not that. Usually in our households, there's just a lot of people, there's a lot of music, there's a lot of background noise, that in order for us to be heard, we have to speak louder. So we forget that there's like a inside voice or like a, so we do get seen as like, oh, they're just too loud or they're too passionate. But it's not that. It's just that in our rules, in our society, in our families, is that if you speak up, you're heard. And so that's something that people don't really necessarily realize, and that can affect your career. This work is based on the work of Dr. Ruby Payne, and she wrote the framework for poverty. And she initially started off in the education world. However, that it slowly realized that this could be affected and worked in the healthcare world and even in the workplace, and how these rules really do play a huge part. So looking at the lenses, there's three of them. There's a poverty class, a middle class lens, and a wealthy class lens. And with them, they have different driving forces. For instance, with the poverty class, it is about relationships. Middle class, it's about achievement. And with the wealthy class driving force, it is about connections. So poverty, mostly we think about is the extent to which an individual does without resources. And so just to show hands here, looking at everyone, just raise your hand if you were first generation medicine. Okay, first generation medicine, okay. And then keep your hands up if you were first generation college. Okay, so for many of you, this is a really important thing because we think about poverty as being the extent to which an individual does without financial being poor, not having enough money. But really, the definition that we're looking at is that poverty is the extent to which an individual does without resources. And those resources are many. That could be, again, financial, but it could be emotional, it could be mental, it could be spiritual, physical. If you break a hip or you get injured, guess what? You don't have the ability to perform your job. You don't have the ability to bring in money. Having support systems, and having knowing the knowledge of middle class hidden rules, and having role models. So I will tell you that the world runs on middle class norms. The medical systems, the healthcare systems, the education, everything runs on middle class norms. Middle class norms run the US. Middle class norms run internationally. So it's very important to know that there are these rules that do exist in middle class. we have to learn, because I was also first generation and everything. I had to learn, and I had to learn by watching others who were successful and seeing what they were doing that I didn't know what I was doing or not doing. Having people talk to me and pull me aside is like, hey, this is what you need to learn. Um, Learning from the nuns. I went to Incarnate Word College undergrad, and so like I used to work for a nun who would pay me $25 and a meal to come in and provide assistance for her dinner parties that she was doing. And she's the one who taught me how to set the table, right? Which fork to use, which knife to use, which is your bread plate, which is your drink plate. Many of us who grew up in poverty, we didn't know this stuff. You had one bowl, one fork, one spoon, and that was it, and so it becomes these things that are learned. And so once you can learn these resources and know these rules, you can move from affluent, wealthy class, middle class, lower class, and you know what kind of rules people are adapting to and using in order to have a better relationship with them. So as I mentioned, it is a continuum of resources. You go from the under-resourced where you have your less educated to more educated. You can have from survival to abundance, from concrete thinking to abstract thinking, from dysfunctionality to functionality. So it is a continuum. It's not set. It's just very dynamic in its aspect. And so what we know about hidden rules, and mostly it's with time and money, is that time and money are very important in these rules. Remember that our driving forces in poverty includes the survival, include relationships, they include entertainment. So with middle class, again, it's work and achievement and material security, trying to save for a rainy day, trying to save for retirement. And wealthy, it becomes all about the connections, both political, financial, and social connections. So you actually know who you're talking to when you go to a party because they will ask you what you do. So people in poverty will never ask you what you do for a living, right? Because everybody hustles a little bit, right? So you just don't say anything, you just show up, right? And people in middle class, they want to figure you out. So they'll kind of say, hey, so what do you do for a living? So they can see whether they want to talk with you or not, right? Or if you're somebody that kind of belongs to the group or not. But in wealthy, if you notice, they'll never ask you what you do for a living. What they'll ask you, like, who do you know? Oh, do you know Dr. Hyen? Oh, do you know Dr. Cigaroa? Oh, do you know this person, right? Or do you know this priest? They never ask you what you do. They ask you who you know. So that's a key point that we want to make with this. Also, time is really something that is going to become an issue in our situation as physicians, providers, as our job working with patients, because time is so important. We talk about in poverty, time about being present, being here in the moment. That's why many people who live in poverty are always late, or who grew up with poverty rules and are always late, because they always have to take care of what's here now in the present. And once this is situated, then we can move on to the future. But but they don't understand the future if they haven't finished the present, because they're very concrete thinkers. So once we take care of this, we move on to the next thing. The planning for future story, like the car breaking down, the taking of the 2 buses to get to clinic, getting the childcare services, that's not all pre-thought out. It comes as a tyranny of the moment where it's like, oh, I have to make it to my appointment kind of thing. And middle class is very different. You have to be on time. It is part of your work and achievement that you are on time. If you are not on time, guess what? Other people perceive you as either being lazy, not caring, not following the rules, and they'll have all these negative judgments about you. Obviously, they're not going to tell you, oh, I have all these negative judgments about you, but they're implied and they're made up. And over time, remember that first impressions are future impressions. They're going to be lasting, and it's going to be very hard to break off that first impressions are lasting impressions, right? And so it's really important to understand that. So that means that when you go to a clinic that may be more affluent, with people who are working more, who have things to, everybody has things to do, but have things on schedule, you being late to see the patient becomes a problem, because now it's their time that you're wasting and so forth. And the same thing with wealth. Wealth, their availability of time depends on the social norms of that, or what the history has for it. And so those are important thoughts to think about. So when we talk about the mental model for poverty, and in poverty, these is a circle of the different things that happen in poverty. You have a lot of social service involvement, schools involvement, police, religious organizations. And if you live in a community that's under-resourced or underserved, there may be some debt, mental health, housing issues. You'll notice that there's pawn shops, liquor stores, corner stores, laundromats, rent-to-own places, fast foods, checking, cashing some services, dollar stores, used car lots, and these are the things that people spend time on. Remember, your driving force is relationships. So I emphasize this because it's very important that a patient feels that it lives in poverty, that they have a good relationship, and respect is very important. That you have to feel that they're respected. And if they don't like you, they won't respect you, or they won't deal with you. And so when we're talking about hidden rules of class with poverty, again, possessions for people living in poverty are people. So it is worse to steal someone's girlfriend than it is to steal money from them, or a car from them, or whatever. Because possessions, these are my friends, these are my people, this is my aunt, this is my mom. And money is always used to be spent. Money is there to be spent. So if you want to increase the money in the economy, what do? You give out a check, because people in poverty will put it right back in, right? People in middle class are going to save it for a rainy day. And people in the wealthy class are going to invest the money. So we look at money a little bit differently. Again, if they like you, they'll include you. They only include people that they like. Entertainment, sense of humor, your mama jokes are really important, because having that personality and being the jokester, being the comedian, is part of their personality about being really popular. When it comes to food, it's not about quality, it's about quantity. Did you have enough? It is very important. Did you have enough? So they're going to be the ones who are going to the $20 for 20 pieces of chicken, because that can feed the whole family. So when you tell a patient that they are feeding their child the wrong food, and their child is sick because of the food that you're giving them, you are basically breaking a huge hidden rule. Because in that hidden rule, in that mama knows that for her to be a good mother is that she's providing food for her child. But now if you go in and you say you're giving her the wrong foods, then you're attacking her as being a good mom. And so you have to be very careful when we talk about this, and about food quantity and deserts and so forth. Again, time is very important for us. So education is saying like, oh yes, I want my kids to be educated. Oh yes, I want an education, but it seems to be very abstract. It seems like it's not possible for us, because remember, we're all in the present story. We're never in the future story. And destiny-wise, we believe in fate. Oh, what God wants. Lo que Dios diga, right? For those who speak Spanish, or Dios manda. God's the boss, kind of thing. So very fate-driven. The other thing that's very interesting with people in poverty is they use a lot of casual register. So casual register is the kind of language that you have amongst friends. It's like, oh my God, did you see that? You see that girl? Oh my, she was wearing the funniest dress. And did you see how she went sideways and she went this? They put in all this extra stuff in there. But for middle class norm, it's get to the point. It's the objective. It's not all the fluff and the subjective. It's like the patient is sick. They need to be transported in the ambulance. These are their vital signs. We need to get them to the ER. So very important to know when to use which type of language and what it means. And then in the household dynamics in poverty, it tends to be matriarchal. They tend to see the world as in the local setting, so they don't really know what's going around nationally or internationally. It's more like what's happening locally in the neighborhood or the neighbors and so forth. And love is seen as conditional. Love and acceptance is seen as conditional. So you're either loved or you're basically not loved. So again, going back to the norms about time, we mentioned it's all about now because the relationship, remember the driving force is relationship. So I have to pay attention to you right now before I can finish the next thing. So I see this all the time in classes where you're not finished with the lecture and it's 10 to 1 and the students have to go to the next lecture. People who understand the middle class norms will stop at 10 to 1. It's like, okay, we're done. We didn't get to finish the rest, but look up the slides. But someone who has poverty norms will keep going, extend the time that the students are there with them, just so they can finish up what they're finding right now, the present story. It's also about relationship building. So something that's really hard because all of us are driven, even in private practice, to see more patients, right? Because the amount of money that we're getting paid per patient is significantly lower, and they keep better care and other contracts are continue to bring that down. So instead of seeing 10, 15 patients, 20 patients a day like we used to, now we're having to see 30, 40. So many of us are, what are we doing? We're taking that computer into the office, right? So we can type as we go. Well, even though it's a really great norm for middle class because it's about work and achievement, you really break that relationship bond with the patient because then they see it like, well, they didn't pay attention to me. They were too busy on the computer, or if you look at your computer, you look at your phone, that is a breaker for relationships. So things that you can do is you go into the room, you talk about the patient, you talk to the patient, especially in poverty, you cannot get to the point. We cannot get to the point right away. It's like, okay, we're here for your high blood pressure, diabetes, whatever. You have to have some kind of thing. How are the kids? How are the grandkids? How's your dog? Something, some little bit of relationship building that you wrote down from the note before to get them ready so that you can actually talk about the medicine. It's also important to know who the decision makers are. Many times in patients in poverty, they will have an oldest son, oldest daughter, grandchild, someone who's making the decisions. Finding out who the decision maker is very important because then you can say, do you want us to give your mom or dad the bad news, or do y'all want to know the bad news first and decide how we're going to tell the patient what this is? So this is important in the fact that obviously HIPAA, right? HIPAA is really important in that saying that the decision maker is going to be the not the actual patient, but the family members around the patient, and they're the ones who help make those decisions. An example about work excuse. Okay, so I have a nurse coming up to me and they say, the boyfriend of the sister of the girl that's pregnant needs a work excuse from his job. And the nurse is really upset because she's like, he doesn't even need to be here. He needs to be at work because he's letting the people out down where he's at work while he's just here, being here. And it's not even his baby. So in the poverty norms, he's going completely in the driving force of relationships because if he's not there for his girlfriend, who's a support system for her sister, then he's going to get in trouble or he's going to lose the girlfriend, right? And so we can see how that kind of can affect healthcare and how having the different norms could be an issue. When we talk about middle class, again, it's about work and achievement. And so the businesses around this are going to be about shopping strips, bookstores, banks. You're going to have vet clinics, fitness centers, coffee shops, restaurants, maybe some golf courses. You're going to be talking about retirement. You're going to have credit card debt, right? That doesn't exist in poverty because many times a lot of them don't even have an ID. And so that becomes, you can't get a bank account. Talking about vacation, social media, childcare issue, careers, having mortgages. So this is more of the world of a middle class. So the interesting about us physicians and medical providers in general is that at one point, I think we were wealthy, but we're significantly not wealthy. We're very much into the middle class. However, the norms of being in the medical provider are definitely norms of wealth. So it's very important to know these norms of wealth, because that's how physicians and medical providers do things. And so you want to be able to understand that and be successful in that. So again, instead of people being your possession, things are your possessions. Like you like to own things, or you like to have a hobby of like collect Hummel dolls, or collect, I don't know, spoons, or whatever that may be. Your money again is to be managed. It's to be saved for retirement. It's to grow. Um, the social emphasis is definitely on self-governance, being able to pull yourself up by the bootstraps kind of attitude. Your food is different. It's not about quantity, it's about quality. How did you like it? How did it taste? Was it yum? Those are the kind of things that are more important. And the clothing is more about brand names, the Michael Kors, the Coach, the stuff that, you want, labels are really important. And again, time is a future. So you're always thinking about future ramifications. So I have to be here on time because I have to be cognizant of other people's time. I always thinking about the future. What am I going to do next? What are you going to do next? And so that's a little bit different than the norms of poverty. Education is very important, because without an education, it's very difficult to climb the success ladder and to make money. And your job in middle class is about making money. We believe in making choices. We believe that we can change the future with the good choices we make now. So in this hidden rules, we're very good to our future selves, because we take care of things now so that we can be healthier at a later date, or we can be better off on a later date. In poverty, we don't see that. So we have patients with diabetes who have, giving them all these, you're going to lose your leg, you're going to go blind, you're going to go on dialysis. And for them, it doesn't mean a whole lot, because guess what? They have a household and family full of patients that have amputees who are on dialysis. So they know that that's their future story. So they do nothing now because they don't realize that they could impact their future, that instead of being diabetic at the age of 30, potentially can wait it off till they're maybe 50, and they will have less complications. So it's a different way of looking at things. Normally, we will be talking formal register when we discuss, and our household dynamics is mostly patriarchal. So it's not so much the mama runs things, but it's basically the father or the male figure, whatever that may be, that will run the household dynamics. And they see the world as a national view. They look at things national. And then love and acceptance is conditional upon achievement. If you do well, you will be loved, kind of thing. If you do badly, then there's less love, right? And so again, the biggest thing with middle class norm is, if you know you have middle class patients, being there on time, showing up to your appointments, having them make decisions. Now, the decision makers in middle class tend to be the patient themselves. And so if you have to give bad news, you give it to the patient, and then they decide whether they're going to tell their children or tell their other family members. But they want to be the ones to make the decisions and for things. When we're talking about the mental model class, and this is the last one we'll talk about, it's all about the connections, right? It's about who do you know? They're the ones who have their lawyer on speed dial, their growth acquisition person online. They know the local priest, they know the local CEO, they call the CEO by a first name. They know all the presidents of the different organizations and groups and so forth, because they're really well connected. They're also on board of directors because they can fundraise. They have connections to politicians, and they have international vacations, and they end up also sponsoring events. Now, this class literally only is talking about 1% of households in the US. And this is like over $7 million worth of assets. So I know that I don't have $7 million worth of assets. So, I'm more of the middle class right now. So, but I know that I will be working with, and I have patients that are in this class. And so then I know I need to be able to adapt with them and know what they want and they need. And so when we look at the hidden rules of class for them, we see that it's a little bit different. we see that for them, their possessions is not people, it's not things, but it's one of a kind objects. They're the ones who have the first edition of books, right? Legacies, pedigrees. This is the stuff that they collect. The money's to be conserved or invested. Give a rich person $100, what are they going to do? They're going to figure out a way how they're going to make it double or triple, right? That's what they want to do, and pretty fast. Their personality is always just for connections, and having high social connections are highly valued. And the emphasis on social is on social exclusion. So if they exclude you from an event, it's because you're not part of their class. The other thing that we don't really necessarily know that's kind of weird, but it's really true. If you go up to somebody who's very affluent or has a wealthy hidden rules of class, if you just go up to them and introduce yourself and start talking to them, they'll be nice and they'll be polite and say, oh, yeah, good to meet you, and talk with you. But then they'll move away as fast as they can because you broke a hidden rule. Because in order for you to talk to a person who is affluent or really wealthy, you have to have someone to connect you with them. So someone who knows you can introduce you, and so that it gives you validity for you to go talk to them. So as I try to recruit preceptors and I have other meetings, and with my role as president of Quixotes of San Antonio, in order to meet affluent people to help us with our project, I can't go directly to meet them. I have to have an inner person connected. And for y'all Catholics, y'all know what I'm talking about. You have the saints, right, to intervene for us to talk to God. Okay, so that same thing happens in this wealthy part, and it's really crazy. But once someone says, I know this person really well, I'm going to introduce you to this person, then you're part of the rules. You follow the rules, and they will talk with you, and they'll exchange your information, and they'll help you out and so forth. But it's a really small little thing that we don't even think about. You can be included in this world if you have something to give. So whether you're like a physician, like I mentioned, there's a lot of physicians who fall into this wealth domain. So have you bring something of wealth, or you're an artist, or you're a celebrity or something, you are accepted into this world. When it comes to food, remember we talked about quantity, we talked about quality, but with food, it's different. With food, it's about presentation, right? So how many of them have gone to really expensive restaurants and paid like, $100 for a dish, and it has like 2 scallops on it, some tamarind sauce like decorated on there with like some sprigs coming up? That's the way that the food is presented for the people wealthy, right? And so you leave really hungry and you go back to having to go eat somewhere else, right? After you spent a lot of money on food, because that's the hidden rule of class. It has to present well. And also the clothing is designer. It's very designer important, not necessarily label, but designer. And the traditions of time is based on tradition and decorum. So at whatever time that is set up for, then that's the time that you show up. So also education. People of wealth do not send their kids to school to become somebody, or to learn a career to go make more money. They're sent to school for connections. And that's why people of wealth will send their kids to higher educations. They'll send them to more expensive schools because they want them to be connected. Because when they come out of school, now, my child is the real estate investor child, that they're going to go into real estate. They need to know the commercial banker, the commercial developer. They need to have those relationships so they can continue to make more money and have more investments and more connections. So that's the biggest reason they go to education. They're also, the destiny is not like mentioned before, where it's like fatalistic, or I can handle this and I do this on my own. Their thought is of noblesse oblige. Basically, it's a French word that means I was brought into this world to help other people out because they cannot do it for themselves. And so because of that, I'm going to be participating in nonprofit organizations. I'm going to give back to people because I'm needed to be able to give back, to be able to patronize the arts, to patronize these programs, because that is my role in this life, is to help other people who are less fortunate. Again, it's formal register. When it comes to household dynamics, it depends on who brings the money, right? If it's the mother side or the father side, they're the ones who have the household dynamics going on. And they tend to see the world in an international view. Love and acceptance is conditional. And they're more likely to marry for social standing and connections than just marry for love marriages. Again, time, they're very future oriented. So you have to be on time for stuff. Relationship building is going back to that. If you want to talk to someone who is in some kind of power position, you have to have a mediator to get in to talk with them so that they can take you seriously and they fit that you can belong. The decision makers on family, as they tend to want to know first, and then they decide who gets to know what's going on. Okay, they don't need work excuses. So some other hidden rules of wealth and that we don't know about is like, it's not okay to not be perfect. And they won't ever tell you this, but it's rigidly followed. Think about it. Think about it in your head. How many really wealthy women that you know that are obese? Zero, right? Think about it. Celebrities, it's different. Actors, actresses, but you don't know any because it's not accepted. And so you will do whatever it takes to not be that way. So you go for surgery, you'll take the medication, you do whatever that you can because it's not okay to not be perfect, right? Social exclusion is a weapon of choice. So you're just not invited to parties. You know that they happen or whatever, but you're not invited because you're not part of that class. Time is more important than money. They're going to figure out a way to buy themselves out of things. So for someone in wealthy class, if I have 80 hours of work 80 hours of work a week, if I hire 2 people and I hire them for 40 hours each, I just expanded my time double. So now I have 160 hours that I can work a week because I've got 2 people that are working for me. That's expanding my time. Paper protocol exists. Oh, let me tell you. The first time I talked to this, I said this presentation at our medical school, I had some kids that were extremely livid. So obviously they weren't part of the wealthy crew, but they were very upset about the fact that they needed to write thank you notes for their preceptors. And the thing is, we offer at every month a whole box of thank you cards that the students are just to go pick them up and do it. But paper protocol exists, which for invitations, for thank yous. So for weddings, you don't get the Evite in a wealthy society. You get the paper presentation. You get for anniversary, quinceañeras, baby showers, whatever that may be. It is a paper protocol. And it's very important as a resident. If you want your attending to look up to you, to really think highly of you, try that. Give them a paper thank you card after the rotation and see what happens. I can tell you when I go visit the preceptors at their offices, they'll have a drawer, they have a wall where all the thank you cards are, and they go and they proudly show it to me because it makes them feel better, right? That they're appreciated. You put a note in there that says, hey, thank you so much for teaching me how to start IVs. That was really important. And I'm going to be using the skill source for the rest of my life. Thank you for taking that time. Because once you make them feel better and you hit those dopamine receptors in their brain, they're going to want to continue to teach. They're going to continue to want to have and expand the knowledge of future residents. You don't talk about anything emotional and nothing is shared openly. So one of the social faux pas that I have seen in residents and attendings and so forth is sharing too much. Like that stuff you keep at home or you keep to yourself or to a real small patient population. I used to have a colleague of mine who would come in the OR and in front of everybody says, oh yeah, I just left him. I found him cheating on me. And it's like, we don't need to know that. It's like, hit her with a knife. It's like, be quiet, just no one needs to know your business. And so it's something that's really important because then everybody sees that you broke a hidden rule and you make everybody else's very uncomfortable. And so indiscretion is also rarely forgiven. So if you go and you talk about something that you saw, that you did, or whatever, and they find out that it's you, basically you're kind of like excluded out of the unit. So that is about hidden rules. Anybody have any questions right now? Did this bring up any like aha moments for you? Anybody want to share?
I remember when I was in a creative writing minor class, that the feedback I got from like the panel of other students was my language was too colloquial. And so I don't want to seem unprofessional, but that's the language I speak, like with my family members or for whom like English is not their first language.
Correct. And so now you know that there's a difference, right? Because you're like, what are you talking about? But you remember that the school systems are set up in a middle class norm, and the expectation is to speak that middle class language. And so, yeah. And no one told you, right? No one told, their teacher just said you spoke very colloquially, but they never really explained to you that there's a difference and there's a rule in language, right? And so this is going to happen very importantly when you have to call somebody else for a consult, right? You're going to call somebody else for a consult and you're going to be, okay, this is a 49-year-old Hispanic male who was found on the street. He's not really responsive. He talks sometimes, he doesn't talk other times, but his blood pressure is noted to be really elevated. And then we gave him medications to stop the blood pressure. And then he started having shortness of breath, but his oxygen saturation looked really good, but I don't know why he was having issues with the oxygen, but it was really low. So we went ahead and gave him O2, and we have him on 2 liters, but then he started coughing and so forth. So we put him on a non-rebreather, and then yeah, and so then he's like coming in, and then he's like starting to hit me, and he's trying to pull out his IVs, and he's being very, very combative, and we don't understand how to hold him down. And yeah, so after he gives this whole thing, it's like, yeah, but he has abdominal pain, and the ultrasound shows that he has gallstones, right? Like the person you're consulting is going to want to shoot you, right? So they at first they want to start and say, okay, I'm consulting you about a patient with gallstones. And this is a 49-year-old man who came in unresponsive, has had multiple issues with elevated blood pressure and shortness of breath. We've used interventions to help him with this. However, on evaluation, he was noted to have an acute abdomen and gallstones were noted. Can you please consult on this patient? So you notice the difference in language from something that's very casual to more formal. And so that is how you're going to be seen as a professional, right? And so I looked up the word professionalism. And so I really didn't really like what it said, so that I looked up profession. So here is about professionalism. The conduct, aims, or qualities that characterize or mark a profession or professional person. Profession is a calling requiring specialized knowledge and often long and intensive academic preparation. A principal calling, vocation, or employment. So medicine is all of the 3, right? It's a principal calling. It's like, oh, I've always known I wanted to do medicine. I love to help other people. This is like the way I can do this. It could be a vocation because that's a family business. Your grandfather was a doctor, your mother was a doctor, so forth. So it's part of like the family business, or just with employment. It's something I do. It makes me money, so I could be able to enjoy my other events and the other things that I really enjoy in life. And it's okay to be all of those. So, part of the talk is to kind of just bring that out. And thank you for sharing that, because that's one thing is people say, oh yeah, you broke the rules, but they don't tell you why, right? So so I noticed that your class is all female. That's going to be very interesting. Congratulations to all the females, but I will tell you that you're going to find yourself being a little bit extra hazed, and it happens to all of us, and it goes away. But you have to prove yourself. You have to prove yourself that you're going to be safe for the patients, and you're going to be safe for your community, including your fellow nurses, MAs, everybody else. So you're going to keep everybody safe. Once you prove yourself, they will back off and they will be loyal to you 100%. But in that process, it is very important to know that they're going to be testing you. And people are going to say, oh, you're too passionate. Oh, you're too excited about this or whatever. And so you're going to have to learn to speak low and slow as a female. Because if you start speaking too loudly or too fast, you get X'd out and your opinion gets tossed to the side. And you're going to have that with other residents and other departments, that they may not take you as seriously because of it. You're going to find it with nursing that you're going to have to go low and slow, because if you get real excitable or you get angry or you get irritated, they've got your game and they're going to poke on you. And so you have to figure out a way where you can be professional without without losing it, and so that they can continue to say, oh, I egged her on pretty good and she didn't take to it. So they'll leave you alone, right? And you'll be more successful your intern year. So here are some topics of professional behavior. One is being on time. We've already discussed this. So the important reason why I brought in the hidden rules first is so that these make a lot more sense, right? So you want to have a good attitude, right? You are the captain of the ship. You are the navigator. Everybody, even as an intern, are going to be looking at you to navigate and control what the rest of the setting is going to be for the office that morning or that day or whatever. So if you get really grumpy, if you are having um, being upset because they're adding patients or taking patients off or they took too long or whatever, then everybody else is going to build up on that. And if they're going to build up on that energy. So you have to remain cool at all times, no matter what it is. I don't know if you have to count backwards. I will teach you some resiliency tricks, but you have to keep cool and you have to have a good attitude, because people see that they are also going to be having a good attitude. It runs off. It like basically it's like it goes from you to other people wherever you keep the cool. But if you get really irritated, if there's a rapid response or whatever, and you get real agitated, then everybody else gets agitated. It's really important. Dressing the part. Okay. So after COVID, there's been this laxity of more people wearing scrubs to clinic and not really caring to comb their hair, maybe not even showering. It's really important. You're dressing up for your patient. You are showing them courtesy. You're showing them that you care about them enough that you came into this to work looking the part, that you care about them, that you dressed up for them. And in the olden days, men still wear ties. They have white shirts, their ties, their jackets, their doctor's coats, and they dress the part. And patients see this. And there was actually some research done many years ago that showed this, that showed that patients felt more trustworthy of doctors that looked the part rather than coming in just in scrubs. So just kind of know that. Now, things change, and so they may be relaxed. So make sure your scrubs are ironed, clean, not crusty stuff from the day before that you wore them. So just be cognizant of that. Being trustworthy. Trustworthy is very important. We want to be someone you can count on. We want to know that you actually saw the patient instead of documenting the stuff that you didn't do that you said you did. It's very important to have strong ethics, boundaries, always seeking to improve, always trying to learn one new thing every single day. And the learning curve is going to be huge. It's like drinking water from a fire hydrant initially. So every time you find those little things, write those little things that you don't understand so you can look them up later or during the day when you have time. Boundaries are very important, and it's going to become really easy to talk to people that are in the clinic or talk to your patients and so forth. But it's very hard that people don't understand that there's a boundary. And so you have to hold yourself apart a little bit. Always have a chaperone. Even if you're a female and they're a female, you want to make sure that there's nothing that can be said that they did this or they did that. So grab a chaperone when you can, especially if you're going to do a pelvic or breast exam. It's very important to know the boundaries, because sometimes, it's happened with me. I've had great relationships actually with MAs and nurses over my lifetime. But they always knew when work is work and playtime is playtime, right? So make sure they know that it's not okay for them to call you by your first name while you're at work, even if you went for dinner with someone. So it's very important to know those boundaries. So unprofessional behavior is you being the problem. Okay, so how is you being the problem? Well, when you're there thinking that you know too much or you know everything, that becomes a problem. When you're constantly fighting the system and you're not the team player, that becomes a problem. I would tell you that there's so much knowledge going on that there's always people doing new studies, new research, new whatever, and there's new protocols for stuff, that people like me who've been in it for 20 years, we still like our old ways of doing things, okay? And so having to be shown up by residents in front of patients and we being your attendings, that's not really a lot of fun. And so I still use triple antibiotics for people who come in with PID and TOAs to the hospital. Other people use Zosyn, they all use all these fancy other stuff. I still stick to my triple antibiotics. Why? Because they work. and they do well and the patients get better. So try not to be always upping everybody else. Try to sit back a little bit and be -1 a bit sometimes, but knowing if you're the one causing the problem and think about it. What's problems going on? Be the solution solver rather than the problem maker. Having an ethical behavior. It is not unknown in the past that people document all the stuff that they did, but they really didn't do. It takes 1 minute to listen to heart, lungs, do an abdominal. Continue to try to do so. Stay away from gossip. It's rampant. Stay away from it. Stay above it. Don't involve yourself. Hear things if they tell you, but say, okay, thank you, and just cut it off because it becomes a problem, and then you become a problem with that. Don't hide any mistakes. If you make a mistake, come up to your preceptor, say, hey, I made a mistake. How do we solve this? Do not lie about things. It will be found out, and it's also part of unprofessionalism. When I mentioned the oversharing, and then lastly, do not involve any of your work on social media. That is so key and important. People have lost their jobs and their careers on this. So please do not put your job on show. Do not do dancing and TikTok at your clinics. That is seen by all these other people. And even if it's fun and games amongst you yourself, it gets shared and people misconstrue it. And there's so many trolls on social media that are there to make everybody else's life miserable. So please try to avoid that. So this was Denzel Washington. Y'all remember this moment, right? So he told Will Smith, at your highest moment, be careful, that's when the devil comes for you. And it's not any more true than when you become a resident and everything's just coming at you. Stay high above everything. Stay high above the gossip, everything else, because it will come for you. They will attack you, and you need to be able to be strong and know that you're doing the right thing always. So I did a little bit of research, and it looks like from your department, we had this article that came out in 2019 on family practice burnout and resiliency. It was a cross-sectional analysis amongst the behavioral health teams from different institutions. And what they did is they received samples from residents and program faculty about depersonalization, emotional exhaustion, accomplishment, and resilience. And with the questionnaires and so forth, the resilience was the only outcome variable that showed significant differences in variance. So what I find that meaning is that we need help with the resilience part, right? And so the most catastrophic, devastating failure recorded history. How can you be so happy? Because now that we know it doesn't work, we can just try something else. How do you rise from the ashes, right? So I noticed when I was an attending there, remember I told you I worked with the most intelligent people that were international medical graduates who are coming into the system and somehow were having a very difficult time through the system. And the fact is that we didn't realize that many times the students that are coming in from internationally, their first year of residency is all about shadowing. They didn't realize that they were responsible to make doctor decisions that were life and death decisions. And once we realized that, we as a department try to work really hard about encouraging residents to start making doctor decisions and to be responsible for the patients and so forth. So it's very important to understand that things are going to go wrong. And as a surgeon, if you don't have any complications, you're not operating enough, right? And this happens with medicine. If you're not doing enough medicine, you're not, if you're not doing enough, having enough complications with patients is that you're not doing enough medicine, because they will come. It's part of the territory. And so because of that, we have some resiliency strategies that we can discuss. So one is a gratitude practice. The other thing that's really important to learn that I learned as a medical student is that it's not your cross. When a patient comes in and tells you everything that's going on in their life, because we're all working in an underserved population, it is not your cross to take everybody's problems that they're going through and carry that home with you. It's the patient's cross, it's the patient's dharma and their life's work that they have to do. So after every visit that you have, you give it back to them. Sorry, Mrs. Lopez, I'm sorry that your husband is not working right now and that things are really tough at your house. I hope that things get better and there's new solutions for you. I will think about you and send you positive energy, whatever that may be. But, let me know when next visit how things go for you. So you just like unloaded all of that on somebody else. When the ashes come, when the fire comes, are you going to become the victim or the victor? Because you get to decide whether it's going to be something good or something that's not going to be good. And if you come out as a victor, you will learn resiliency skills that whenever that opportunity presents itself again, you know the skill sets that it needs to be able to surpass it and do well. But if you say, why me? Why did I do this? Why did this happen to me? Then you're never going to grow from it. So remember that that's really important. Staying present, having self-compassion, movement in nature, being out walking, something that breaks up the monotony of your day. Finding people that are like-minded, and job crafting. Sometimes it gets really frustrating to know that you're doing something and there's a lot of burnout, but find out another reason why you're really there to do it and try to continue with that job crafting. So job crafting could be like there was a custodian who worked in the cancer center, and he was there to clean up. Sometimes patients have nausea, vomiting. So he's cleaning up an episode, and the patient's so embarrassed, and she's like, "Oh, I'm so embarrassed this is happening." He's like, "No, no, no. If it wasn't for you, I wouldn't have a job." For him, he job crafted it as being there to make the patients laugh in bad situations. So that's why he woke up every morning. That's why he went to work, because he knew that he could make somebody's life better. And so when we understand the hidden rules and it provides a framework for us to be professional at all times. And John Maxwell says, a minute of thought is greater than an hour of talk. So before you say anything that'll get you into trouble, make sure you take a breath, count to 10, think about what you're going to say, and then say something, and then find a mentor. So with that is the conclusion of my talk, and I'm almost at the end. So if anybody has any questions, please let me know.
Dr. Nato, you had raised your hand earlier. Do you have questions?
But that's been overcome by events. But I did want to just close by thanking Letty for the excellent talk. This was very timely. I think we're at the beginning of the new year. I think this will help get us re-energized and emphasize the last point about mentoring. I think it's super important all the way along to have people reach out to people. I think sometimes when we're younger, some of us tend to think, oh, who'd want to help me? Well, actually, a lot of people want to help you, right? I think you find a mentor and they will help you. And most everybody is willing to serve as a mentor. Most people find that to be gratifying and rewarding to be a mentor. So just to emphasize that last point about mentoring, reach out.
So you have access to my email address. If you have any questions, please feel free to text me or send me an email. My phone number is there as well, so you can text me and we can talk about something that kind of befuddles you or you had a question on it and would like more time to discuss it.
Yeah, Dr. Vargas, I just wanted to perhaps make a comment. Thank you for introducing these norms regarding different classes. Perhaps that helps us to interact with patients coming from different backgrounds. We only have a snapshot with them in the clinic setting and working in team settings in the professional environment. I think having these as a backbone, what the general expectation might be, it helps us to understand and communicate better with our team member, with our patients. But again, I think we are on the individual levels, we again, we have to get to know that person to understand that perhaps it's the background, but everyone behaves differently, have their own beliefs, and we just have to get to know that person and channel our doctor in ourselves and build relationships based on your knowledge and your interactions. I think I want to emphasize that moving forward. I think that the point of the tips about professionalism, that's excellent. We have to have a clear expectation what is to be expected of you in training as well as in professional environment. Thank you so much.
Thank you.
Thank you.
Very
Thank
much.
you.